Welcome back. It's Dr. Jen Ferboni, better known as DocJenFit, your doctor of physical therapy. And I want to go over some exercises you could do if you're getting some inner knee pain. Now, we actually have a podcast all about this. So sometimes when it's not just like at the knee joint, but it's a little bit below, or maybe right now, you take your fingers and you kind of rub on the bone that actually is right below the knee. And if it feels a little tender, it feels a little bit like, oh, that's what I've kind of been feeling. Well, then it could be your Pes Anserine. And what happens is we get a little bursitis in this area, and we have a whole podcast that can help you understand exactly what Pes Anserine is and what the research is saying, and a couple more exercises. But I just want to go over 3 basic exercises that are really going to hit the muscles of the tendons that attach into this area, so we can start rebuilding the tissue tension and tendon health that comes into this area, and hopefully help you to reduce some inner knee pain. So I'm going to use one of our lightest bands, a part of the Optimal Body Therapy Kit. We have a bunch of different kinds of resistance bands, from the loops to the long bands to a thicker band as well. And it also comes with a free back plan. So if you don't have bands available at home, you can snag this kit, and it comes with that back plan to help you understand how to best utilize a lot of these tools. Plus, they're just going to come in handy for videos like this. So this first one is going to address our hamstrings. So in this inner part of the knee, we have what's called our semitendinosus that comes, and it's going to connect on the inside of this knee on the lower leg. And so we want to start to address any of the weaknesses through its full range of motion that can be happening as it attaches into here. So I'm going to place this band around my feet and lay down. So when I'm here to help with the band, I'm going to actually flex this foot because it keeps a lot of the resistance, and then make sure it's around my other foot here. Okay. And then I'm just going to think of pulling on the band as much as possible. And then nice and slowly, I'm going to think of releasing the band. So I have a little bit more resistance as I'm coming out into that lengthening phase of the exercise. And then I'm going to pull. Now, this is where you can also use one of the long bands that we have in the therapy kit, tie it around something really stable, like a rack or something that's not going to move. And you can then just use a loop of the band, put it around your foot, and pull from there. So if you don't feel stable in this current setup, you can also use the long band. So hopefully you're just doing a few of those. You start to feel that resistance and that muscle working. So ideally you want to do about 10 on each side, 2 rounds total. And if you go really slow like that, you should start to feel the burn in the back of the leg. Then we're going to address our sartorius muscle. This muscle is going to be along the front of the thigh. So again, looking at this connection to the inner knee, it's going to come and it's going to wrap around the front of my leg up into my hip. So it's crossing from my hip all the way down to my knee. So I'm going to use the band again, laying on my back. And this time I'm going to think of lifting against, so I want a little bit of tension against that band, and I'm going to pull it up. So I'm doing flexion, and I'm going to do external rotation and bring that knee out a little bit. So it's coming out and the foot is coming up toward me as much as possible. Bring that knee out, bring that foot up, and then really slow on the way back straight. So bringing it up, rotating that leg. So this is external rotation and abduction. So pulling it out, and as I pull that knee in and then coming down, you're going to feel those flexors all around that hip really working, but we're wrapping up and around that knee as well. So we're getting that entire muscle to start to work. And again, this is where 2 sets of 10 can be a good place to start. But if you're going really slow and you're noticing, wow, this is really tough, especially if you've never done it before, that's where even just doing 5, doing 8, making sure that you're focusing more on how you're doing it, making sure you're going slow rather than the highest amount of reps. So that's not what's most important. It's the intention of how we're doing it. Now, the last muscle that's going to connect into this inner knee is called our gracilis, and this is our inner thigh muscle. Okay. And it's going to cross that knee and then come right down. So we're thinking of all three of these tendons around this inner knee kind of starting to work and activate. And this is where you can start to use exercises beyond these three to start to understand, okay, what else can I do that's going to start to address what I'm trying to focus on here? So with a straight leg, because we're crossing that knee joint, I want to think of lifting against a little bit of resistance and then coming down. We don't have a lot of range of motion, and it's especially harder when our leg is straight. So it's okay. It's not going to be the most resistance, but there's just a little bit of resistance here as I lift up and then come down. So lift it up. You can even hold it if you want a little bit more of that work for the inner thigh. So holding about 10 seconds and then lowering down, holding about 10 seconds. And you can just do 10 on each side, 5 to 10 on each side, holding that for 10 seconds. And you're really going to start to feel that burn on the inner thigh. So again, starting to work all of these muscles where the tendons kind of cross and go into that knee and all connect together at the same point is going to help so that we start to reduce any friction and tension and start to heal those tendons. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.